Hello, and thank you so much for tuning into the program today. I'm your host, Neal Howard, here on Health Professional Radio. We're barreling through this month of September, which is Menopause Awareness Month. And while most women associate hot flashes and mood swings with menopause, there are some other symptoms that postmenopausal women may be a little bit reluctant to talk about with their doctors. Now, returning with us today to talk about what to expect and how to treat some of the uncomfortable symptoms of menopause is Dr. Lisa Masterson, former host on The Doctors, and she's currently sharing health and lifestyle information via her website, Health and Heals with Dr. Lisa. Welcome back to the program, Dr. Lisa Masterson. How have you been?
I've been great. Thank you so much for having me.
Great. Now, what are some of the symptoms associated with menopause?
Well, some of the really common symptoms that people, and it's a normal and natural event that people associate with menopause are, hot flashes, of course, mood swings, memory lapses, difficulty sleeping, weight gain. One that a lot of people don't associate necessarily, or at least don't talk about as much, is feminine dryness. And that's really important because it can lead to painful intercourse, which can affect the person's quality of life and relationships. And so it's very important to know that that is actually a symptom of menopause.
So do these symptoms vary between a woman who's actually in menopause and those that are postmenopausal?
Well, menopause, the definition actually means when a woman stops having her period for a year. And postmenopause, that's the time where the estrogen has had time to actually have an effect on the tissue, so the vaginal tissue, and that leads to what we call vulvovaginal atrophy, which is thinning and inflammation and dryness of the vaginal tissue, and that's what actually leads to the painful intercourse, what we call dyspareunia as in medical terms. And this dyspareunia can be very severe. Moderate to severe dyspareunia can really cause problems with intercourse and with relationships. And so, and even though a woman may feel embarrassed about talking about it, she shouldn't, because 1 in 3 women, that's a lot, 1 in 3 women will suffer from moderate to severe dyspareunia, painful intercourse. So it's really, really important that a woman feel comfortable about talking about this with her physician.
And how can her physician assist her in feeling uncomfortable and more at ease talking about this?
Well, if they should actually bring it up. If they don't bring it up, then that's what we want. We want the woman to find a voice and ask about it, because there's so many different options out there. And just knowing that it's so common that she's not alone, that's 1 in 3, and a third of a woman's life is spent in postmenopause. So this is something that just about every doctor is familiar with, if they're treating women. So it's really important that they feel comfortable bringing it up, knowing that it's common, that it can affect their lives for a long, long time, and that there are treatment options, unlike hot flashes, which will eventually go away on their own. If you don't treat the tissue, it can actually get worse. So it's really important to get treatment for this.
So you feel comfortable with your physician, or maybe you haven't quite gotten there yet. Is there anything that a woman can do to treat her symptoms on her own, or is this something that has to be consulted with her physician 100% of the time?
Well, she should, for treatment, yes, you do need to consult your physician, because there are moisturizers and lubricants out there, but they're just temporary relief, and they don't actually treat the tissue. And, and that's one of the reasons why I'm thrilled to be able to come on your show and to talk about different treatment options and talk about the fact that it does need to be treated, because one of the treatment options that I'm really, really excited about and have the opportunity today is Ostina, which is the only FDA-approved once daily dosage hormone-free oral pill. There's vaginal things out there, but I've found with my patients they'll stop using the vaginal things because they're messy. So it's really great to have all these different options to empower women so they can take control of their sexuality in their lives. You do need to consult with a doctor, because it does come with risk factors, cardiovascular disease and endometrial cancer. So you do need to find out if this is the right fit for you with your doctor. It is a prescription, but again, a woman can get relief, in less than 12 weeks. And so it's really important for her quality of life that she have this dialogue with her doctor.
You're talking about quality of life, open dialogue with her doctor. Talk a bit about how a woman's partner can assist her, in menopause and postmenopausal, as this affects relationships, as you alluded to in the beginning of the interview.
Well, by being a support, because this is a time of change in a woman's life. We're very hormonal beings. And during this time of change, if they do notice changes, to maybe just very gently, maybe bring it up. So a woman may, really seek out help for this or know that it's even a problem. She may not know that she's having mood changes or problems with memory. So sometimes it is actually helpful, and again, in a very gentle way, to point out these things that may be happening, so that a woman will seek out help from her doctor. But again, to be in a supportive way as these changes occur, so that women can seek out the help from their doctor. And because it is a normal and natural event, they also need to know that it's not something they have to just accept as part of menopause. There's different treatment for different symptoms out there.
In conjunction with some of these treatments that you've been talking about, in your experience, how does diet play a role, and can it play a significant role in alleviating some of these symptoms?
Well, you always want to eat healthy. You want to have a healthy diet that's balanced, and that just goes for your health. Exercise is really, helpful. Those are it's living healthy, and that's just going to help you with all of them. Unfortunately, there are more hormonal type of things, so diet's not necessarily going to help you with hot flashes. It's not, as far as just helping your bones and skin, we say, calcium for your bones, which is due to decreased estrogen going on in your body. So there are some things, yes, having these, increasing calcium and vitamin D are going to help, like with your bones and your teeth. But, you're just going to want to lead a more healthy lifestyle. If weight gain is the problem, again, it's the metabolism that's changing because of the hormones. Exercise, which is always a good thing to do anyway. So you want to definitely make sure that you're kind of on top of it as far as healthy living.
Now, where can we go online and get some more information and raise a bit more awareness during September, which is Menopause Awareness Month, Doctor?
Go to Osphena.com, and you'll get a lot of information about menopause, about Osphena, which is great, and I'm so thrilled again to be here on behalf of Duchenet USA. And there is a quiz that I have on there that'll help you, find out if you should be talking to your doctor about this. So tons of information if you go to Osphena.com.
Always a pleasure. Thank you so much for coming back and speaking with us today, Dr. Lisa Masterson. Been speaking about menopause, some of the symptoms as they relate to post-menopausal and menopausal women. Thank you so much. I'm hoping you'll return and speak with us some more in the future.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm.